Hello everyone, I'm Dr. Sean Liu, sports orthopedic surgeon dedicated to keep you moving comfortably and confidently. Today, I'd like to talk about something that affects many active individuals, meniscal injuries. You might be wondering, what's the difference between a meniscectomy and a meniscal repair? Understanding this can make all the difference in your recovery and the long-term knee health. First, let's briefly discuss the meniscus. Think of it as the knee's natural shock absorber, a C-shaped piece of cartilage that cushions and stabilizes your knee joint. When it's damaged, you might experience pain, swelling, or a catching sensation. Non-surgical treatments like rest, ice, physiotherapy, and anti-inflammatory medications are often our first line of defense. These methods can be effective for minor injuries or tears. However, when symptoms persist or the tear is significant, surgical intervention becomes the optimal choice. Now, let's delve into the two primary surgical options, meniscectomy and meniscal repair. A meniscectomy involves removing the torn portion of the meniscus. This approach is typically used when the tear is in the white zone, an area of minimal blood supply where natural healing is unlikely. By carefully excising the damaged tissue, we can alleviate pain and restore function. On the other hand, a meniscal repair aims to preserve and heal the meniscus. This procedure is ideal for tears located in the red-red or red-white zones, where blood supply is sufficient to promote healing. By suturing or sewing the tear up, we enable the meniscus to mend itself, maintaining its crucial role in joint health. Why is this distinction important? Preserving a meniscus through repair can significantly reduce the risk of future arthritis and joint degeneration. While the meniscectomy can offer quicker relief, it can lead to an increased wear on the knee over time. Recovery times do differ between the two procedures. After a meniscectomy, many people return to daily activities within a couple of days. A meniscal repair requires a little bit more patience. Typically, patients undergo a few weeks of dedicated rehabilitation, but the long-term benefits to your knee integrity are substantial. Addressing meniscal injuries promptly is key. Taking action now can prevent further damage and expand your treatment options. Imagine returning to the activities you love without knee pain holding you back. If you experience knee discomfort or suspect that you have a meniscal tear, I invite you to take the next step towards recovery. Your journey to optimal knee health starts today. Let's move forward together.